The next 10 years, the healthcare industry is going to have a revolution like never seen before. The next 10 years will be bigger in terms of change than the last 50. And a lot has to do with artificial intelligence, the advancements in biotechnology, but also since the pandemic, the digital transformation that we all went into. And so the question that I would like to answer in this week's Pascal's China Lens is, could China be leading this healthcare revolution globally? What I've experienced over the past 5 years in China when it comes to healthcare has been such a transformation that I can only imagine how the next 5 years will look like. And so I believe in the next 5 to 10 years, China is going to lead the global healthcare revolution. Now, to explain it, I would like to take you to a personal story. This goes back 2014. I had a pneumonia. I was overworked, but I had no idea that I had a pneumonia, so I went to the hospital, Beijing Hospital in Shanghai, very close to where I lived, and I went to actually see a doctor. So I had to wait a couple of hours and then I could see the doctor. And what was amazing is that as soon as I got to see the doctor, within a minute, he could tell me I had pneumonia. I said, how did he know? Well, he sees so many patients that he could immediately identify it. Now, I had to do an x-ray at that point and it took about 30 minutes. 30 minutes later, he had it confirmed. And the verdict was that I would have to stay for 3 weeks into an IV room. What that means is that every day for 2-3 hours, I had to have some needle in my arm with an IV and get cured by the medicine that was in there. And I did that for 3 weeks, and this was a crazy experience because for me, this is like 2014. I saw all these people, sick people, all in one room with all the germs, and I was like, how can this be healthy? But even my staff at my company, when they felt not very good, they didn't feel well, they had what they call a gaomao in Chinese, a flu, they instantly went into the hospital, got an IV into their arms, and after an hour they were cured. And we in the West, in Belgium at least, I would sit at home for 1 or 2 hours, sit it out, sweat it out, and then be cured as well. But no, in China, they want the quick fixes. So this was my experience. But during that time, I really observed the medical staff, and I thought this was amazing. Because what I saw there, I've never seen anywhere else. The speed and efficiency that these nurses could actually put needles in people's hand, never make a mistake, do it very quickly, work synchronized together. I mean, this was like a factory on steroids. Amazing. And so from that point on, I got a lot of respect for the medical staff in China. And I always, if I had something, I always went to a Chinese hospitals. I wasn't even thinking anymore to go to a foreign hospital back home. So this was my personal experience. But what's happened in the last 20 years, 30 years in China has really been transformative. So there's a lot of things in society that changed so fast that the medical industry, the healthcare industry could not follow. Think about environment, think about substances, think about alcohol, cigarettes, pollution, lifestyle with obesitas, lots of problems that have occurred in China, like 10 times bigger as a problem that it used to be 30, 40 years ago, which of course puts a lot of strain on the hospitals. On top of that, there's still a lot of poor people that didn't get insurance before or couldn't afford these expensive health care. And the biggest problem of all is actually the professionals. There's not enough general practitioners. There's not enough doctors in China. There's about 1 doctor for every 6,600 people in China. In the West, in a country like Belgium, it's about 1 for every 1,000 or 1,500 people. So it's like 4 or 5 times less doctors per amount of population that China has. A huge problem. And that's because this medical industry did not keep up with the pace of the whole industry, the whole population that wanted more healthcare and could afford more healthcare. Now, on top of that, you have the aging population. I made a video 2 weeks ago about that, and there you could really see that these people are getting older, and of course they need more healthcare and medical care. They're not living with their family anymore, so big change societal. And so that changes really dictates a new healthcare need. And this is what I've seen in the past 5 years. But if you would have gone to a public hospital 5 years ago, any public hospital in any big city in China, what you see every morning is that there's like hundreds of people lining up at the door until the door opens. As soon as it opens, they all rush in to be the first to get an appointment with the doctor at the secretary desk. And as soon as they get an appointment, they can see a doctor. And a doctor in a public hospital in China 5 years ago was seeing on average 100 to 200 patients per day. 200 patients per day, imagine. That gives you 5 minutes to understand the problem, give a diagnosis, a prescription, and then it's next. And I experienced this a couple of times. It's crazy. And that's why they're so efficient, because they see so many people, but at the same time they don't have a lot of time. So there's no time for this personal connection. On top of that, when you go and see a doctor in a public hospital, very often the doors are still open because it's just too much. It takes a minute to open and close a door every time. So look, just keep it open. So every time I was telling a story to a doctor or my wife, we always had like 3 people in the back cheering in and say, don't worry, this is all going to be fine. It's hilarious, but privacy, big question mark there. So a lack of privacy for sure. And if you think about the trust level, then this doctor sees 20,000 patients a year. So if you ask any Chinese anywhere in the country, if a machine like IBM Watson, that based on millions of data points, can actually tell you with a pretty high accuracy whether you have skin cancer or not, would you trust this machine, or would you trust a doctor that you don't know, don't trust, and basically are worried about? Except if you get recommended, which is still often the case in China, go to that doctor, which means that every Chinese is going to the same doctor, so some are overworked and others don't have a lot of work. But in China, if you ask that, every Chinese will choose for the technology instead of the doctor that they don't know or don't trust. And so this is a very different thing from the West, where we, specifically in Belgium, where I live, my doctor takes like 30 minutes time to talk to me, they know my family, they know my history, they know everything. So very different. And that's the cultural difference. And that's why technology in China is really something that was booming over the past 5 years, specifically in artificial intelligence. Now, there's some companies like BioMind in China, and BioMind is a Chinese Singaporean corporation. And just 3 years ago, 2018, they did a test, a competition between the machine and the people. And they said, okay, let's have a pool of doctors, surgeons, brain tumor surgeons, and this BioMind machine that can detect brain cancers, brain tumors. And within half an hour time, these doctors figured out with a 66% accuracy, the people who had a brain tumor. The machine, in just 15 minutes, did it with an 87% accuracy. So if you tell that story to a Chinese, to most of the people, they will actually say, of course, this machine is more accurate. I trust this machine more than I trust this person. And so this is a very different environment. And that's why technology got embedded so quickly into healthcare. It actually creates more trust. Now, if you look at the technology in itself, artificial intelligence, AI, there's no doubt that China is leading on AI globally. I mean, there's this technology race between China and the US, but they're really at the same level. Companies like E2, but also companies like Baidu, like Alibaba, like Tencent, I mean, they're putting in all their algorithms which are top-notch and applied in the medical industry. But then there's also the digital transformation. If you look at that, during the pandemic, Chinese were using these health QR codes, and Financial from Alibaba developed it, and very quickly it was deployed everywhere. Everybody was using it, no questions asked. I know it was compulsory for many, but at the same time, they had little problem with using it. Look at an application like Good Doctor from Ping An, the insurance company of China, the biggest one. Then you see that Ping An Good Doctor had already, before the pandemic in 2019, about 350 million users. Today we're talking about more than 500 million Chinese using telemedicine, telehealth to consult a doctor and get diagnosed through their mobile app. No problem. Everybody's used to it. So China is like 3 to 5 years ahead of the West when it comes to these technologies. Now, when you look at equipment, there's companies like Mindray and United Imaging in China. Mindray is in Shenzhen, United Imaging in Shanghai. And they have great equipment from ultrasound to PET scanners and everything you could imagine. But they're only 30 years old, some of them even 20 years old. And so 20 years ago, this was really the low end. This was really competition on price. Then 10 years ago, they started to compete on the middle end. And today, they're competing on the high end. But it will take probably another 5 to 10 years because before these companies will replace the most expensive machines from IBM, GE, Siemens, Johnson & Johnson or Medtronic, all these top machines, it probably takes another 5 to 10 years. But they're getting there. And today, my hospital in Belgium is using Mindray for ultrasounds, and they think this machine is as good as GE. So I think we shouldn't underestimate the power of technology and equipment coming from China these days. The other thing is biotech, and that's a long story, but we don't have time for that here. The reality is that in the pharmaceutical industry, this industry has been very upset with China. It's probably the industry which has been the most upset with the regulation in China. They had real challenges to get their patents, but they also had problems when it comes to copycats that weren't, that the government and the regulators accepted, and they were going for generic drugs instead of new biotech or new developments. So the foreign companies were really not treated fairly. That's what you always hear in the pharmaceutical industry. And in a way, it's true. But the reality is that China chose for actually helping millions of people rather than actually helping the industry. Did they do it right? Did they not do it right? Big question. Reality is that is what it is today. But for the biotech, specifically the last 5 years, but even 10 years ago it started, there's thousands of scientists, life scientists, PhDs that came back from the West to work in China now and basically are adding to the new biotech industry. And if you look at the vaccine from COVID-19, I mean, they're not so bad. I mean, they're doing real great job. And there's lots of examples where the biotech industry in China is now leveling up with the biotech industry globally. And they're pouring billions in. So I have a very good feeling that give it 5 or 10 years and China is at the same level, maybe even leading. Now, if you talk about healthcare, you also have to talk about TCM, traditional Chinese medicine, because this is still very important in China. And as we know, this is centuries old, and most of the Chinese, they like this history, this tradition. And when you go to a hospital, you go to a doctor, you typically get Western medicine, Western drugs, but you also get the Chinese equivalent, the TCM equivalent. And this is not just about old people that want to keep a traditional life. No, even young people, kids are learning in school about TCM and keeping the body healthy. If you see now millennials, and even youngsters, Generation Z, they're really going into these tea houses and getting infusions with TCM parts because they believe that this is all about their culture, it's all about keeping fit, keeping healthy. And so this is a new trend of an old tradition that is coming back as well. So this is really about the current China. Now, the interesting thing about TCM, about traditional Chinese medicine, is that they look at the body as one whole. Everybody is unique. And of course, everybody is unique. But if you look at Western medicine, we don't think that way. We look at averages and we think a drug works for 99% or 98% for everyone, so we give the drug to 100% of the people. But you could be different. And so in the Western medicine, we look at curing problems based on average and based on what we've experienced or the results of an experiment. But in China, they look at all your factors of your past. They look at your factors of your lifestyle. Did you sleep enough? Did you eat enough? Did you drink enough? And they look at lots of stuff, where you live, pollution, whatever. And so this is looking at every individual differently. Now, in the Western medicine, when we look at every person uniquely as one, we get into the genomics area. And this is about DNA and genes. And so this project, it started in 1988, is the biggest project that ever happened in that area. The Human Genome Project. It took 15 years, but after 15 years, a lot of countries helped into the research. They found 20,500 genomes. So the whole body of a person was put into a map so they could detect and figure out the whole DNA structure of a whole person, of every person individually. And so this is looking again at the person itself, at individuals. Now, the company in China that participated in that project, which was 15 years long, is actually BGI. And this company, BGI, they are now the biggest genome sequencing company in the world. They started in 2003, once their funding was ended with the Human Genome Project. They had no more money after the project stopped. And so they went into the commercial by sequencing the gene. At that time, it was still millions of dollars to do. Now we're talking about hundreds of dollars because everything evolved. They also bought one of the biggest American companies that has this equipment, which is Complete Genomics, which is a competitor of Illumina, the biggest American gene sequencing equipment manufacturer in the world. And so they now have this capacity as well. Not only do they produce the machines, they're also doing the sequencing itself. And they have a huge database of DNA. Now, the CEO of this company was actually called Wang Jing, or Jun Wang in Chinese. And Wang Jing, in 2015, he decided to leave the mothership, although this was one of the most promising and still is the biggest company in gene sequencing. He said, I have to do more for society. And so everybody was wondering, why is this guy leaving this company? And the reality is that he thinks, and I can really recommend the TEDx that he has online to explain the whole story. It's about 10 minutes, so I don't have time for that. But the reality is that he explains that he wants to make a digital map of every human. And so the gene or genome is the starting point. That's really what makes everybody unique. But that changes over time because we live in a certain environment. We have medical history, we have a lifestyle, maybe we have bacteria or viruses, or we have all kinds of omics, as he calls it, that influences our life and our future and our health. And so what he's doing is he wants to take all that data, and he's been doing that for the past 5 years, to then put artificial intelligence to work on it so that you can actually manage your personal health. You can know exactly how healthy you are and what you should do, could do, cannot do to actually improve or make it worse for your health. And this is about personal health management. Now, what I like about Wang Jing is that this is typical, an example of a scientist, an entrepreneur, someone that is like an Elon Musk, it's like a Steve Jobs, it's like somebody in the US in Silicon Valley that came up and has these moonshot inventions that want to change the world. Like the Google of healthcare is what he wants to create, or the Amazon of healthcare. And so we never see or talk about these people, but they exist in China. The reason we don't talk about it is because they don't look for as much exposure in the rest of the world as the Elon Musks do. And so it's a very different culture, but they do exist, and there's lots of them. And these are really cool people. Now, the other thing is the government, and you can't detach healthcare from the government anywhere in the world, but definitely not in China. And in China, there's now the Healthy China 2030 plan, and that means in the next 9 years, China has real targets. And so this plan, which was built many years ago, is actually putting real targets for 2030 on life expectancy, on infant mortality, child mortality, and lots of things. There's a whole list of targets that they want to reach. And so far, they've been reaching their ahead of targets sometimes, and they're reaching their target every year, which is really impressive. But China has to do this, and can only do this by changing the whole infrastructure, but it's also changing the way people think about healthcare. And that's the other thing that is so strong in China, which takes much longer in the rest of the world. They have put healthcare into all the policies in China. And that means anything you want to do, whether it's about the environment or about education or about the economy, whatever you think about, you have to have healthcare somewhere in there. Just like sustainability, these are two topics which is always have to be in every industry, in everything that China is doing. And so this goes top down. And that means every local government understands they have to build clinics, they have to invest in biotech, they have to invest in automation and new hospitals and so on. The second thing is my health under my control. And this is like Wang Jing. First, you need to know how to control it, but this is also about telling people, telling 1.4 billion people how to take more care and better care of their health. And that means exercise, it means eat more healthy, but it's also things like use TCM, awareness, it's about these digital apps, it's about medicine that is available. So there's a lot of information flowing to the people to improve their health. And the third thing is China sees health and healthcare as a growth of the economy. It's like an engine and motor for the economy. While we in the West often see healthcare still as a cost center, in China they're starting to see it as an opportunity, a way to make money. And this is because tourism could improve, health tourism, it could improve in TCM that gets sold, maybe also globally. There's a lot of things like exercising. This could all make money because there's new industries popping up. And so having these targets, having this mindset change, having a blueprint and helping people to elevate out of their healthcare crisis sometimes is really what the government is taking care of. And this is quite unique, and that's why I think this revolution is really happening. But it also has something to do with the infrastructure. China is really great at building infrastructure. I mean, the best at building infrastructure. They've done it for the high-speed trains, they've done it for 5G, they do it for electrical vehicles. We've talked about that in previous videos. But now you see this in healthcare as well. Every hospital is getting automated. They're buying the most expensive material or equipment from abroad, from GE, from Philips, from Siemens, from anybody, but also their Mindray and United Imaging. Everything's getting automated. And what that means is that these hospitals, these clinics, can now elevate these nurses and these doctors to do better or more work that they otherwise could not do because they don't have the skills for it. These robots can do it. The second thing is research, and China's putting everything on research, specifically biotech. They want to become the biotech leader in the world, and they're really doing a good job in that direction. But it's the billions of dollars they're putting in it, and also helping the education to focus on that industry. And that is going to change a lot. But for me, the thing that is really changing China when it comes to healthcare is this accessibility of digital healthcare. It's telehealth, it's remote healthcare, it's doing everything. And thanks to 5G, that's now possible to do remote surgery, but also just with a mobile app, you can have a consultation with a good doctor. There's no problems anymore. And so this is a complete change where in the West, we only see this happening now post-pandemic. And in China, it's happened for the past 5 years. And this is exploding now. Now, the last thing is about private. Many companies are offering private solutions for customers, for citizens in the healthcare industry. And that is because the middle class got richer, and so they can pay more, they can afford more. And so you see almost these hotel hospitals or clinics where you get treated like a VIP. And this is another level. This is not for the general public. Now, the general public now, 98% has basic universal healthcare insurance. But there's still people that say, I want better treatment, and then they can afford it. And this is a booming industry, also in the retirement homes. So we see a lot of things happening. So the infrastructure in the next 5 years will be so impressive that we won't be able to recognize it anymore. Now, I think we should stop looking down on China when it comes to healthcare. And of course, there's a big problem on healthcare. Just because there's 1.4 billion people, lifestyles have changed, and the hospitals could not follow, the doctors were not enough, so big crisis, and they need reforms, and there's been a lot of corruption. But let's not look down on it anymore, because I think China is reiterating and completely thinking differently about the healthcare of the future now, and you see it happening in real life. Now, if you compare to America, I mean, in America, it's of course, they're the number one in terms of healthcare, North America. I mean, great doctors, great equipment, great hospitals. The problem is, it's not accessible to everyone. Only if you have money. Many people cannot afford it or cannot actually don't have the insurance to get these good treatments. And so, in my view, you can't call this a revolution, healthcare revolution in North America, if it's not for everyone. But that's just my personal opinion. Now, in Europe, where I live, in Belgium, pretty much healthcare is available for everyone, and it's very inexpensive. The government is paying back most of it, so it's really very accessible. The problem in Europe is regulation and mindset. A law gets regulated, meaning that new technologies like digital and AI, it takes time before it gets implemented, and it's a very traditional industry. On top of that, people are a little bit afraid to take that next step. They still prefer to talk to a doctor person to person. They don't trust that machine as much. And so that just slows down this whole process. So I think China just takes the best of both worlds. It's really accessible to everyone, and it's also something that gets quickly implemented for the whole population, and it's top-notch and getting better and better. So give it 5 or 10 years. I predict China is going to lead the revolution in healthcare. So I talked about a lot of aspects in the healthcare, but there's still a lot more to talk about. And I didn't go in depth in each of these industries, biotech, AI. I mean, there's stories on itself. But I hope it gives you a general idea. And do subscribe if you haven't done so you can follow my other videos on China's innovation. I hope you liked it, and see you next week for another episode on Pascal's China Lens.